Hello, everyone. So we're gonna begin this topic of um, meiosis and cell division by introducing another condition, as we often do. So we'll talk about a particular condition or disease or disorder as a starting place, just to kind of discuss the importance of the process. And in this module, we're going to talk about something called Edwards syndrome. Edwards syndrome is another really sad condition. We started the semester talking about Tay-Sachs disease, which is also a sad condition because it leads to child fatality. Edwards syndrome does this too. So it's another one that is really sad to think about. In Edwards syndrome, babies who are born, a lot of times actually, babies will be miscarried before they're born, but which means they'll die during pregnancy or they'll be stillborn. So if the baby's born and they're born with multiple organ defects, including the heart and the kidneys and intestines and the head. So as a result, babies are rarely going to live more than a few months from this. So it turns out this is again a condition that infects babies. Babies who have Edwards syndrome, they're more likely to be born to older mothers. So the age of the mother matters. So a 40-year-old mom is more likely to have a child with Edwards syndrome than a 20-year-old mom. So we're going to talk about why that is and what can we do about that later in the semester or during the semester. There is some preliminary testing that is available that can be used as a screening testing. If someone is having a baby, maybe they're on the older side and they're going to have a baby, they can get tested for Edwards syndrome. And then they can do some confirmation tests in case, that comes out positive, then they can do some more tests to confirm it. And then the mother will have to decide if they want to keep the baby or they want to, go through an abortion, which can be a very challenging decision to make. If they want to terminate the pregnancy because of the likelihood of the baby having Edwards syndrome. Or sometimes baby can die during pregnancy. Or if the baby is born, baby can be dead within a few months of the birth. So those are decisions that they'll have to make. So I just want to leave it here, and then we'll discuss this again at the end of the module. So I'll stop here.